Hello everyone, I'll discuss question of neurology. So we are getting a 11-year-old boy brought to the emergency department by his parent. He cannot walk anymore. The patient had a pin and needle sensation and weakness in both feet for the past few days. This morning he could not stand up or move his leg and bilateral thigh pain is there. 2 weeks ago, the patient had a febrile diarrheal illness that resolved of its own. He had no headache, nausea, vomiting, or recurrent diarrheas. His family are vegetarian and they are recently visited to a petting zoo. Patient had no significant past illness and vaccination are up to date. On arrival, temperature is normal, BP is slightly on the higher side for a child of 11 years. BP 150/90 definitely high, pulse 92, respiratory rate normal, saturation is normal. Examination shows bilateral symmetrical flaccid paralysis of the lower extremities and absent ankle reflexes and deep tendon reflexes. Sensation is intact to light touch. Upper extremities are weak and hyporeflexic. No photophobia or nuchal rigidity. Structure and which of structure is primarily impaired in this patient condition? Well, they are talking about something unique, special where the problem is. The answer is peripheral nerve fibers. Why is the answer? Well, Guillain-Barré syndrome is an immune-mediated polyneuropathy. Okay, and it is caused by demyelination. Of the peripheral nerve. Most patients have a preceding respiratory or GIT infection, like in this case also. The patient had a GIT infection, diarrhea. Now the question is, which GIT organism is most commonly involved in the pathophysiology of Guillain-Barré syndrome? Stop the video, write down the answer in your copy. Well, Campylobacter jejuni. The patient with recent direct contact with the animals that triggers initial immune response. The patient went for a petting zoo, that could have been the one reason of contact. But definitely this very frequently asked question asked in all the exams throughout the world. Campylobacter jejuni. Well, antibodies are made and they direct toward the antigen on the myelin or axon. Myelin, it to be more, this myelin are because this is a type of demyelination. Now, in immunology, this process is known as what? Quickly stop the video, write down the answer. Well, this is known as molecular mimicry. Motor nerve are the most commonly involved. That's why patient has flaccid weakness, areflexia. Sensory and autonomic are also involved, but sensory is very uncommon, but autonomic are fairly common as compared to sensory. Rather, in our question also, patient has BP of 150/90. This is all due to autonomic nervous system dysfunction. Classical presentation include ascending type of paralysis. The weakness start from distal part of the feet of the leg or feet, and finally they rise upward. They may have some paresthesias and neuropathic pain, as seen in this patient also. Patient has thigh pain. Weakness begins in the lower extremity and ascend. That's why it's a type of ascending paralysis. And finally they may involve respiratory and bulbar muscle also. Well, when the patient really has very severe disease, total flaccid paralysis with diminished or absent deep tendon reflexes. Respiratory failure may occur. again this is due to paralysis of diaphragm paralysis. That's why whenever we are seeing any case of Guillain-Barré syndrome or Guillain-Barré syndrome, patient should be always should be monitored very carefully for respiratory failure, and they should be facility for ventilation. Well, as far as I told you, patient may have autonomic dysfunction also, BP or take heart rate instability. ILS can be there. Okay, they usually parallel with the motor deficit. Treatment include intravenous immunoglobulin or plasmapheresis. And prognosis, most children, they fully recover. Okay. Well, again, I have a question for you. Stop the video, write down the answer. What is Miller-Fisher syndrome? Write down the answer in your copy. Well, it is a variant of GBS. And classical thing is external ophthalmoplegia, areflexia and ataxia. And in 20% cases, there may be urinary incontinence or retention. It usually follows antecedent infection. And whenever you will be getting question about Miller-Fisher syndrome, you will be always getting question on antibody, and they are ganglioside antibodies, which are GQ1B antibodies. It is there in 95%. It is highly specific. Dear friends, Miller-Fisher syndrome, this is the key word to remember. Key word to remember. Invariably, these two words indicate that you are dealing with Miller-Fisher syndrome. Golden words to remember. Let's look into other option. Anterior horn cell. This follows. Now, what are the conditions which may involve anterior horn cell? Well, spinal muscle atrophy. Again, it's a type of flaccid paralysis in infancy. Polio, unlikely in this patient because patient is fully vaccinated, so it's unlikely. But definitely it lead to anterior horn cell. And amyotrophic lateral sclerosis, upper and lower motor neuron palsy are there, but usually seen in adults, not a problem of pediatric, but there are feature of upper motor neuron palsy also. This patient and vaccination strongly rules out these possibilities. Okay. Well, dorsal and lateral spinal column, vegetarian and vegan are increased risk of vitamin B12 deficiency. And vitamin B12 deficiency can lead to subacute combined degeneration. In fact, subacute, what we use is combined degeneration. First of all, we should understand why we call it combined degeneration, because there is involvement of dorsal column and there is involvement of the lateral corticospinal tract. Okay, so that can lead to upper motor neuron type of palsy, lead to weakness, paresthesia because of dorsal column involvement. Well, this spinothalamic tract are not involved. And we all know they contain pain, touch and temperature. So that's why these sensations remain normal. Dorsal column carries position sense and vibrations. Right. So again, I have a question for you. Stop the video, write down the answer. Vibration sense we check by tuning fork. Now, what is the frequency of the tuning fork that we use when we are using testing for the vibration sense. Stop the video, write down the answer. Answer is 128. 512 is the most common wrong answer. 512 we use for hearing, but for vibration sense we use 128. Well, now when we are talking about subacute combined degeneration, ataxia and loss of vibration sense are there, and which is not seen in our patient, so that's why this option ruled out. Again, I have one more question. We talk about B12. It is absorbed in which part of GIT? Just simple question. Stop the video, write down the answer. Answer is distal ileum. That's why those diseases which involve the distal ileum or terminal ileum, like Crohn's disease or TB of the intestine, which classically involve the terminal ileum, the vitamin B12 deficiency occurs. Okay, now look into other option. Muscle fibers, myopathies or a disorder involving muscle fiber like polymyositis and dermatomyositis. In these, they have proximal muscle weakness without paresthesia. Okay, because primarily there is a more muscle involvement, and even areflexia is not a feature. Remember, in muscle disease, reflexes remain normal. But in our patient, areflexia is there. This is not the chance. What about neuromuscular junction? Disease involvement are botulism, and it's a classical descending type of flaccid paralysis. Okay. Well, again, I have a question for you. Stop the video, write down the answer. Botulism is a type of food poisoning, okay, and food poisoning where GI problem is usually not a feature. But first question, it tend to occurs with which consumption of which type of food? Write down the answer. Which type of food? Stop the video. It is canned preserved food. Okay. Well, what is the finding in the eyes? One more question for you. By which we are dealing with botulism poisoning. Finding in the eyes. Stop the video, write down the answer. Dilated pupil. Classical finding is there. Myasthenia gravis is the other type of neuromuscular junction. Gravis. Weakness that worsen with the use and improve with the rest. And evening fatigue is the classical feature. Now we have one more entity called Lambert-Eaton syndrome. Proximal muscle weakness occurs. An organophosphorus poisoning weakness accompanied by multi-system cholinergic symptoms are there. Well, I have a question, one more question for you. Stop the video, write down the answer. It's a simple question. Lambert-Eaton syndrome is associated with which cancer? Very simple question is this. Which cancer is there? Stop the video. Small cell lung cancer is often associated with small cell lung cancer. Golden line to remember, Guillain-Barré syndrome or Guillain-Barré syndrome typically present with ascending weakness and diminished or absent reflexes. Following this, recently GI tract or respiratory tract infections, especially Campylobacter. Pathogenesis is the immune-mediated demyelination of peripheral nerve fiber. It's a type of acute demyelinating polyneuropathy. Thank you very much.